and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I'm chatting with Cody Bartrug about the upcoming presentation here at our Gold Neonatal Conference. Welcome, Cody.
Thank you.
It is wonderful to have you here. Yes, the Gold Neonatal Conference is just around the corner. We get started on May 30th, and you will be presenting live, will you, Cody, right?
Yes, I will.
That's wonderful. So first of all, before we get into the topic and into the presentation, first of all, we have an international audience here. Where in the world are you?
So I'm based in San Francisco at University of California, San Francisco at their Mission Bay campus, which is the Children's Hospital.
Wonderful. Thank you for letting us know about that. So, and speaking about now your background, so you say you're at university there. Tell us a little bit about your professional background.
Yeah, so I am a registered nurse there on the NICU, so the Neonatal Intensive Care Unit. It is a level 4 NICU, and that we do everything there. And it's, I've been there for going on 3.5 years now. I started there as a new graduate nurse and have recently taken over as chair of the Pain and Palliative Committee there, and we're doing a lot of work in that area.
Describe your work a little bit more about the that committee. That would be interesting for our viewers to learn more about.
Yeah, so part of the Pain and Palliative Care Committee on our unit is just establishing policies and procedures that help assist in just alleviating some of the palliative nature that is for our patients being on our unit, and then also just dealing with ways that we can mitigate some pain and in terms of painful procedures, and also just getting standardized processes in place so that when we do approach these situations that we know exactly what to do for our patients. And then on top of that, I do a lot of the end of life care for patients who unfortunately have shorter stays with us due to serious illness.
Yeah, very important areas there. Pain management is so important for these vulnerable little ones. They go through so many medical procedures, so much. And I feel like, and correct me if I'm wrong, we have seen a lot of change in that field in recent years. There's been now committees in place just like yours, trying to mitigate pain, and even going into, okay, what adhesive can we use? Do we have to have these big stickers on the babies? How can we, really make sure that the pain medication, the dosages is right, and all that. So what do you see in your area there? You said you'll be there like, not that long, not decades and decades, but you probably have seen quite also some changes, haven't you?
Yeah, the field of neonatal pain is, unfortunately still relatively new. As you go back and look, we used to do open heart procedures on neonates without any pain management. It's part of it's unfortunately a fairly new area in which we're creating any sort of headway, but there are great opportunities in which we've improved on. Part of those, is just learning what are some of the ways in which we can mitigate some of that pain, even simple things such as, swaddling the baby, providing positive touch, to even mitigate some of the many heel pokes that we provide for those patients. We have learned much about how the receptors receive that pain and how we can mitigate that, from things using like sweeties, which is sucrose, and that we use at our hospital, and also just areas involving parents, like skin to skin while we're doing lat draws and things like that as well.
Yeah, that's what my next question actually was about skin to skin. And we recently, I saw some research and also had a speaker here who was talking about the medicinal properties as in pain management, like breast milk as well. So
yes.
I wanted to see what you have to say about that.
Yeah. Unfortunately, it's for us, it's still a nuanced way in which we are involving parents. I think historically we had the assumption that parents don't want to be a part of those painful procedures, but if it's actually provided an opportunity for those parents to do what they are, which is parent their children and help to mitigate. And if they can do that by holding or breastfeeding, that is a fantastic way that they feel helpful and useful for their babies.
Yes, absolutely. Absolutely. Well said. Yeah, because you were so right. I don't know why in the past we assumed that parents didn't want to be part of this. This is, that's a way for them to bond and be a parent. Absolutely right. Now, the other area you talked about was end of life, palliative care that you provide and be there. And I can only imagine that must be a very, very difficult field, and even how to approach the conversation with the parents, how to care for the parent as well. So tell me a little bit there about that.
Yeah, so part of it, part of my background is that I was a parent initially of my daughter Quinn. She was born with a congenital heart defect and also born extremely premature at 25 weeks. So unfortunately, she suffered a grade 4 bilateral brain bleed, and we did. She ended up dying, and so that kind of pushed me into this area. Not only with, I was part of a support group specifically for parents who have lost their babies, but also just in helping to improve that care in the hospital, specifically on the NICU, the neonatal units. So part of what I do is educate. So educate the staff members on how to have those crucial conversations with parents, especially ahead of time before the trauma actually takes place. Because, it's not that we're trying to prepare them for the worst case scenario, but, we do want them to understand, what could happen, and then also what are their wishes in that, because it's oftentimes in a situation where trauma is happening, they're not able to really process that in a way to where it's meaningful. So, education is a big part of what I do. I think also just this research project that I'll be presenting on is I've had the opportunity to do a qualitative research project and deal with parents who have lost their babies. And to really hear their voice and give their voice a platform. So so I think that's an exciting part of my job as well.
Well, first of all, condolences for your loss there.
Yeah, thank you.
And also that puts you on a mission to really be in the field you are today, and have these discussions and educate. That's what a wonderful legacy you're carrying there for your daughter, to be there for other parents and the little ones, of course, as well. So that's beautiful work you're doing there.
Thank you.
And I was briefly a bereavement doula when I was becoming a midwife. I still have the certification. I haven't worked in the field, but I know how having these discussions, it is so important with parents, right? They're in a shock situation, they're in shock and grief, and things haven't set in, and all these kind of questions, everything is coming to them, bombarding them with information, questions. It's very, very difficult, and they're so vulnerable in that time too. So do you see, I mean, in your institution where you work, in your hospital there, you have that in place, but there are so many hospitals still that don't have a good system or a good support system in place, right?
Yeah, I definitely do see that, specifically in more rural hospitals. And my institution is one that unfortunately deals with death quite a bit because of the types of patients that we receive. But, I think unfortunately many other hospitals, especially level 2 and level 3 NICUs in the United States, don't see death as often. So those policies and procedures are just not in place because they don't see it so often. So that's why it's great for national and international platforms like this to be able to share with what hospitals are doing, and hopefully what we're doing at our institution to help at least put the thought out there for those hospitals to begin thinking through that, because
Right.
it changes the outcome for the mental health outcomes for the parents in such a tremendous way when they're able to have voice in the matter and continue to be able to parent their child even after death.
Absolutely. Yes. And as you mentioned, this is an international platform. So really, I think a lot of places will be able to benefit from that information. And as you said, putting the thought out, putting out information there that maybe something that could be adopted in their institution, or, or maybe made fit to, in a way that works for them better, and getting the resources out there as well. So that will be very helpful. So thank you for joining us for this conference. Now let's also talk about your presentation. It's titled Building a Legacy, Views about Autopsy, Organ Donation, and Research Donation After Neonatal Death. That's another very difficult conversation, I can imagine, approaching a parent, right? So tell me about this.
So the project initially came as a result, being at UCSF, our institution is an educational institution, and oftentimes we have physicians who are also scientists. And Betsy Crouch, who is one of the neonatologists on our unit, she also runs a lab where she is studying brain vessel, blood vessel development in neonates, and part of what she's seeing is that there is a limit on tissue samples for her to actually be able to conduct her research, and so she kind of followed that line of where the holdup is, and oftentimes it comes down to just lack of asking, and so she was able to create this project, this qualitative research project, so that she can kind of come down, get a more there. When the research that we've done and looked at, there isn't much standardization across the board on how to bring up these conversations. There's a lot about the importance of it, but not on how to do it. And I think that's where, the holdup is a lot of times for physicians, just the discomfort in having to have those conversations in particular, and then also just not having the familiarity or the training to be able to have those crucial conversations in a way that isn't harmful. So, I think there's a lot of insecurity around that. So, hopefully, with this project, it does create some standardization in how we are able to approach these conversations. But ultimately, I think it was important for us to do a qualitative study because we wanted to hear from the voices of those who have been affected by either being asked or not being asked for autopsy and organ donation, and what was their perspectives on it. So we got to partner with a local organization who does grief support, specifically around neonatal death, and we were able to conduct interviews with these parents and really able to hear their voice on the matter, because that's ultimately what was more important. We have our own subjective thoughts on what it could look like or what we think it should look like, but really we wanted to take it to those who are most affected by it, which are the parents. So I think as a result, I think building a legacy was the biggest takeaway from it. And as you mentioned earlier, that was my biggest strive in giving meaning to my daughter's life, is, trying to create some change. And I think we learned that in the simple tasks of just asking for autopsy or organ donation, to give these parents opportunity to continue to make decisions around their child, and then also just creating opportunities for their legacy to go on and give their small life, but a very meaningful life, some that continues to ongo and affect others as as they move forward.
Meaningful, very meaningful life. Yes, I absolutely agree. Well, thank you so much. Well, Cody, before I let you go, do you have any last words for us here, for our viewers?
I think it's obviously a very difficult topic to talk about, and I understand that many times it's uncomfortable, but I do appreciate those of you engaging in this topic because it is important work, but also knowing that, like, as medical professionals, we do have to take care of ourselves. So obviously take breaks when you need it, and revisit this information when you can, and because ultimately it does create powerful change.
Thank you. Thank you for saying that, because I don't think it is said often enough that care providers and in the field, they need to also take care of themselves and take breaks and then revisit and then also take it from there and take it into their hospitals. Thank you so much, Cody Bartrug, for this conversation, and thank you for coming here to present on this very, very important topic.
Yeah, thank you for having me.
And now some information for our viewers. If you would like to find out more about this presentation and all the other presentations in the conference, we would like to invite you to go to goldneonatal.com. You find all the information on the presentation. It's there. And yes, this presentation is live, but not to worry if you cannot be there live. All the presentations are always recorded, so you can watch them at a time that's more convenient for you. So we hope to see everyone at the conference. Bye-bye for now.